Support for Radio Friends comes from OsteoStrong. Improvements in bone density, strength, and power can be achieved by weekly 5-minute no-sweat sessions on their 4-Spectrum machines. These isometric robotic machines safely emulate high-impact loading on different parts of the skeletal system, which stimulates activity in bone-building cells. Balance and agility can be improved by 2-minute sessions on vibration plates. Every session is supervised by a trained coach. Learn more on Facebook or call to set up a complimentary wellness assessment and session. Good morning and welcome to Radio Friends. This is Thursday, December the 29th, as we're wrapping up 2022, going into 2023. I want to introduce you to Matt Gass. Matt is the Regional President of Burrell Behavioral Health. Welcome back again.
Hi, Paul.
Matt.
Thanks for having me back.
You are a not-for-profit organization which assists people throughout all of central Missouri.
Yeah,
right?
Absolutely.
Give us a quick overview of what Burrell Behavioral Health is and what you're trying to accomplish.
Sure. So in mid-Missouri, Burrell provides community behavioral health services. And so if you think way back to the Kennedy administration as the Community Mental Health Act was being formed, making sure that every community and every town had access to behavioral health services. And so, we really started our roots as a safety net provider. But over the years, as we've become a certified behavioral health clinic, we've really become sort of the Midwest's largest hub for specialty services like outpatient therapy, psychiatry, case management. When you think about community behavioral health, it's really about creating access and making sure that a person, as they're navigating the behavioral health system, doesn't have to make choices in a complicated environment. We can serve every need that a person may have in that behavioral health sphere, or we can refer out to local agencies.
Now, when you're talking about behavioral health, what category are you in there?
Oh yeah, that's a great question. So we often used to talk about mental health, right? We just the brain itself, but we separated humans, and so we separated. This is a behavioral or a mental health condition from the substance use. And so what we've really learned over the last 20 or 30 years is that individuals are complicated, and we may have somebody who has depression or anxiety
that has nothing to do with substance abuse.
Absolutely. And we may have somebody who, because of past trauma or experience, has a predisposition to addiction and being more influenced by alcohol or other drugs. That
What is the youngest patients that you care for?
Oh gosh, we see a lot of kiddos down to the age of 3.
So you got kids who are 3 years old that are having problems.
It's traditionally, we've served kids in family units, and then what we've also seen is during the pandemic, especially with kids, those rates are rising. There's some new data
because
out
of isolation.
Isolation, changes in family structure, additional stresses that people are facing as it relates to inflation and political unrest. It's just been a tough couple of years.
Now you opened a new clinic near downtown. Tell me a little bit about that one.
Fun story. And so this clinic was really it's sort of a dream come true for us as a community behavioral health center. We want to make sure that we're reaching out. We talked a minute ago about access, and so sometimes access is making sure that rural communities in Marshall, Sedalia, Boonville have access to all the services that we provide through telehealth. But in Columbia, we know that there's a group of people and that's really difficult to get across town. Maybe it's a mom with with several kids and getting across town on the bus. And so this clinic's located on Providence and Ash. It's our new outpatient therapy hub, and it's located in what some people might call the United Way building, if we're familiar with that location. A couple of other programs that are there that maybe the community doesn't know that we have or that they're aware of. A program that we call Impart. Impart's really focusing on the needs of mothers and parents of young children. Maybe they're dealing with their own mental health or substance use related condition. Or the other program that's really interesting there is a transdisciplinary team for transitional age youth, 16 to 24-year-olds who are making that transition from.
You're basically dealing with every age group is what it boils down to.
Yeah, I think we're as a community behavioral health center, what we're trying to do is what is it that you need at this point in your life? And then really trying to fill the gaps that we see in the community.
Now, last time you were talking about the new behavioral crisis center that was getting ready to open. Can you give us a little bit of an update there?
Sure. This is really about commitment to access. And so whether it's placing a physical clinic at Providence and Ash, or really adjusting how care is given during the pandemic. This behavioral crisis center, it's another place where we're really working to fill this gap. And so it's an urgent care. If you think about primary care, and you think about how, you and I, we may go see our primary care physician once or twice a year to get a checkup, maybe refill our prescriptions, those types of things. But, at various points through the year, we may have a cold or a flu. Maybe we need some stitches or something like that. So it's not to the range where we need to go to the emergency room, but we know that care doesn't happen always, or the need for care doesn't always happen between regular business hours.
Exactly. So this crisis center is there. You're located where?
So that is on the north side of Stevens Lake Park, so 1805 East Walnut. And you'll see a large Burrell sign right there. Yeah. And so that the interesting thing, I think the last time that we were here to talk, we were talking about this as a new center that was getting ready to open. Mm-hmm. Today I think we're very close, and on January 1st, going from 7 a.m. to 7 p.m. to that center being open 24 hours a day, 7 days a week.
Well, good. That's good. And it's for adults 18 and up, right?
It is.
Yeah.
Absolutely.
Okay. The other thing, we're almost out of time, but you're participating in Como Gives. You want to give a plug for that?
Sure. Yeah, so our Como Gives group is about our MPART program, making sure that, especially as we think about this through the holidays, that we support families and support families with children. We support moms who may be because of other concerns or issues with the family. She may be worried about making sure that her kids get to occupational therapy. We help them with that, or making sure that she's able to maintain shelter and safety for that group of kids.
So you can, if you want to make a donation to Burrell's MPART program, mm-hmm. you can go to Como Gives. You have till December the 31st to make that donation.
Thank you, Paul.
You're welcome. Is there anything else? We're just about out of time. Anything else you want to add?
I just a reminder to everyone. If you don't know a number to call for behavioral health, dial 988. That is the 911 for mental health or behavioral health needs. Or
we have a crisis call 800 number. That's 800-397-2132. Or as he said, 988 anytime.
Absolutely.
Thank you very much, Matt, and Happy New Year to you.
Thank you, Paul. You as well.
Something you'd like to hear or see, I'd love to hear from you. Drop me an email, pepperp@missouri.edu.